Thank you to the Canadian Society for International Health for the invitation to join you all today, and for the opportunity to bring greetings and best wishes for a productive meeting, and that's from all of my colleagues at Public Health Ontario. It's very energizing for me to look out and see colleagues from a range of perspectives and organizations that are gathered to address such a pressing public health issue, hepatitis C, in a priority population. The perspective that I bring on behalf of my organization represents our scientific and technical advice and support role to clients both in public health, in health care, in government, and in related sectors. And this is with a view to helping protect and promote health, but critically also to contributing to reducing health inequities. So with reducing health inequities in mind, we are aware that barriers exist to effective prevention and treatment for hepatitis C virus, and that these barriers may disproportionately affect certain groups, notably immigrants. While effective treatment is possible without access to screening, diagnosis, and care, we know from modeled estimates using Ontario data that there may be a potential looming increase in the serious and at times fatal sequelae of chronic hepatitis C infection. And as you're well aware, those would be chiefly cirrhosis, liver failure, and hepatocellular cancer. So Public Health Ontario, like our public health colleagues, takes a population perspective when thinking about hepatitis C. And we were partnered on the Ontario Burden of Infectious Diseases study published a few years ago that estimated that hepatitis C virus is the single most burdensome infectious disease in the province. And this is in large part due to both the reduced functioning as well as the premature deaths that are associated with chronic hepatitis C infection. If we look to more recent data, in 2013 alone, over 4,000 newly diagnosed hepatitis C cases were reported to public health units in Ontario. And that's a rate of just over 30 cases for every 100,000 people in this province. Between 2008 and 2012, Ontario's annual rate of reported hepatitis C virus cases exceeded the national rate. And while over that time, over the decade leading up to 2013, we saw decreases in both the Ontario and the national incidence that was reported to public health, when we look at modeled estimates, they suggest that it's possible that the true incidence of new cases may be increasing slightly while prevalence declines. What's our role in public health? How can we collaborate with many of you who are here today representing community organizations or the clinical perspective as examples? So I'll just spend a couple of brief minutes orienting you to our public health structure in Ontario for those of you that may not work with us frequently or from out of province. We have 36 local public health units and work together alongside both provincial and federal public health agencies, laboratories, and government. And we work in turn with our clinical and community colleagues and clients. And the focus of our work includes surveillance, testing, screening. As an example, public health units may directly offer screening for hepatitis C, or they may refer those with risk factors for screening. Harm reduction activities, including distribution of sterile needles and syringes, or drug and injection preparation equipment. Public health is also involved in case management when newly diagnosed cases are notified to public health. Public education is certainly within the remit of our work that we do, and as is outreach to special populations, including those in correctional facilities, Aboriginals, as well as newcomers, the focus today. Given that surveillance is a bread and butter function of public health's contribution to hepatitis C prevention and control, what can we know from our public health surveillance data about hepatitis C in Ontario? The 2013 data tell us that hepatitis C, and this won't come as a surprise to any of you, continues to affect men, women, and children across the province. New diagnoses were reported in all 36 of Ontario's health units in 2013. And we know that those individuals diagnosed and reported to public health were more likely to be males in their 50s and females in their late 20s. We know that there's variation across the province. So our health units in Northern Ontario reported higher rates of hepatitis C than their Southern Ontario counterparts. And those are rates rather than counts. We know that injecting drug use was and continues to be the most commonly identified risk factor for acquiring hepatitis C infection when we're able to identify such a risk factor. We also know that some cases continue to be reported among infants and children of hepatitis C carriers, suggesting missed opportunities to prevent mother-to-child transmission. So that's what our public health surveillance data can tell us, but what can't it tell us about hepatitis C in Ontario? We know that our surveillance data are imperfect measures of the true patterns of hepatitis C infection in the population in our province. For example, the rates don't capture those undiagnosed and asymptomatic acute infections, and that would be a source of underreporting. On the other hand, we know that they have included persons that have antibodies to hepatitis C virus, but who may have already cleared the infection or been successfully treated. So this would be a source of overestimation of the burden of illness. To try to address some of these challenges, the Provincial Infectious Disease Advisory Committee on Communicable Diseases released a report in 2014, and one of their recommendations is around changing the way we define a case of hepatitis C for public health surveillance purposes. And given our focus on immigrants and hepatitis C today, it's relevant to note, as I'm sure you're all well aware, that routine hepatitis C screening is not required for immigration to Canada. Public health monitoring of hepatitis C has also been limited by a lack of linkages between some of the key health and administrative data sets. So that would include, in Ontario, laboratory data on hepatitis C testing, and, for example, Citizenship and Immigration Canada data that can help us understand our immigrant population. However, we do know, certainly, that many newcomers to Canada and to Ontario arrive from countries, as Eva has said, from countries where healthcare risks related to factors such as blood transfusion and the reuse of needles or medical equipment are still thought to be driving hepatitis C transmission. And despite the fact that gaps do exist in what we know about country-level data on hepatitis C seroprevalence, the Provincial Infectious Disease Advisory Committee on Communicable Diseases in this 2014 report has gone ahead and recommended that public health units that do offer clinical services and hepatitis C counseling and testing offer those services to newcomers to Canada from highly endemic countries with culturally appropriate counseling and follow-up. The Provincial Infectious Disease Advisory Committee on Communicable Diseases has also recommended that public health units certainly encourage their partners in primary care to do the same, to offer hepatitis C counseling and testing to newcomers. On a note regarding data linkage, Public Health Ontario is collaborating with some of our partners and clients, and that includes Dr. Jordan Feld, who will be speaking after me, on several projects that aim to really build capacity for doing integrated population health monitoring of bloodborne infections, including hepatitis C. So through new data linkages, we are making efforts to help us better understand the burden as well as the health system impact of infectious diseases in key groups, including immigrants. Ultimately, this work really aims to inform action around reducing health inequities related to infectious diseases in our province. So thank you again for the opportunity to be with you this morning. I look forward to learning from you. And on behalf of Public Health Ontario, thank you for your continued efforts toward improving hepatitis C virus services for immigrants in Canada.